I'm Anne Snowdon. I'm a nurse by training. With HIMSS, I am their Chief Scientific Research Officer, and I'm also a professor at an Ontario university and do a lot of research in digital health, what it achieves, and who does it achieve outcomes for.
Thanks, Anne. Great to chat with you at HIMSS again. Don't tell anyone, but it was probably my favourite interview last year, so I'm excited to.
Thank you.
No, what I found interesting last year, and I haven't gone into the detail and looked at every element of it, but I do feel like someone with your own experience and seeing what you've seen within healthcare, but also taking a practical lens and a clinical point of view as well. We're in an age right now here at HIMSS 25. A lot of cool, exciting potential and innovative technologies to apply, but still the same challenges in healthcare, but also some new challenges. So I'd love to get your take on, I guess, what's happened the past 12 months and what's really important right now.
Yeah, such a good question. It's actually many questions. The difference between now and a year ago, I would have to say, has little less to do perhaps with healthcare and much more to do with rapidly changing geopolitical environments,
yes,
technology that's part of that, but not really. It's just another dimension. Technologies are rapidly advancing. Everything is about AI, which has great promise, no question. When I superimpose those things onto healthcare, then I think what's very compelling right now, when populations are under very high uncertainty, when there are economic pressures, we know health takes a hit. People's health, wellness, quality of life is challenged by those kinds of conditions. Technology is fascinating, interesting, holds great promise. I am not seeing yet in global health systems those technologies being embedded and scaled and demonstrating very clear outcomes for people's lives, quality of life, and population health. The hope is we get there, but I'm not seeing it yet.
I've got a couple of trains of thought, and I'll go down one, which is there can sometimes be a disconnect between what's a commercially viable business model within healthcare and what certain populations within parts of the world really need from solutions. Yeah. Hopefully it's not a triangle with an increasing amount of distance that as we continue to evolve, it's getting further and further apart. But what's your take on, being able to fund and build agency and advocacy for doing the things that really matter in healthcare through the lens of, hey, if we're going to get people excited about it, there's got to be money behind it, and it's got to be cool as well.
Yeah, it's a great question. And health, there's a very wide variability on those business models. And I think of those as what are the drivers of change and advances, whether technology is part of the change to drive particular outcomes for people or not. Could be.
Yeah.
Technology for technology's sake is, as Hal Wolf would say, very expensive. Put into old organizations makes a very expensive old organization, right? He shared that with us in the keynote.
Yeah.
But I think where it needs to start is, what does the population need? What are the population health challenges that any global health system must address in order to advance their mandate, regardless of the country, to help their citizens stay healthy, sustain their health, or improve their health, whatever those conditions may be. Being very clear on what population health or health outcomes an organization is seeking to achieve is fundamental, because until you figure out what success looks like, how are you going to know what technologies you need? So for me, it starts with, what is the population need that organization or country or region serves? And how are you going to define success? Because if you don't define it, you can't measure it, and then you don't know if you've ever achieved.
Yeah.
Then the technologies make sense as to, okay, we need this combination of technologies to engage with people, to help them help themselves be healthy and well.
Yeah.
And that's how the logic works for me. And that's where I see very high-performing health systems making some interesting progress.
Yeah. And there's obviously a plethora of challenges to solve and technologies to apply to those in whatever region that you're in. If I think, because I'd love your thought on other parts of the world and maybe even specifically the US, happy to take a pick. But I know in Australia, for example, continually increasing burden of chronic disease in areas where healthcare is not as accessible geographically or financially, and that's where we kind of need to address things at, I guess, a federal level the most, because that's where assistance can be provided. But also it's getting the clinicians out there in the first place to be able to provide a quality of care. And there's tech that can assist in connecting people in remotely to do bits and pieces too. But I often feel like that even if we had all that infrastructure there and even the clinicians there, I often think about how much of a gap there still is in terms of, we call it health literacy, but how much people give a crap about healthcare, like themselves, and until they're sick, like then it's an issue. So I'd love to hear, like in other parts, I know that it's, there are some consistency across the world too, but I often sometimes think, like in the US, the US has just due to the size and the magnitude of it, what the US does has an impact on the other parts of the world too. So love your take on that.
Yeah, Australia is very, very similar to Canada. Both of our countries have large land mass, relatively small populations, and we all live quite far apart from each other, right? Yeah. So delivering healthcare under those conditions, we have the far north, which is fly-in only. You have the outback, and right. That's a very unique population health challenge. Digital connectivity for rural and remote populations, exceptionally important, because quite honestly, I have not found a country yet who can be sure that every rural and remote community has access to the clinicians they need to help them when they're sick or help them stay well. Yeah. So we have a global workforce shortage. It will more than double in the next 10 years. Yeah. We will not train our way out of that. No. So in order to leverage the strengths we have in our global workforce, digital has to be a driver of connecting people to provider teams they need to work with in order to manage their health and wellness. Yeah. I think that's one. A second area I think we haven't really spent enough time on is we're a very disease management system generally. To your point, you get sick, you don't feel very well, that's when you go and seek help. Yeah. Why aren't we leveraging these amazing technologies like AI and others to identify who's at greatest risk in our population? Yeah. And how do we wrap services and care around them or engage them to help make sure those risks never happen? That's a much less expensive model of care. So what kind of a system would be able to achieve that? Well, it depends on the drivers of the system. Yeah. You need the models of care that are proactive, data-driven, to know who you need to prioritize and is facing the greatest risk. Yeah. But then you need care delivery models and teams expert at helping people stay well. Yeah. That tends to be, in many countries, our public health system. And there are, in Canada, less than 2% of our global budget spent on public health. So perhaps what we're seeing is the need for that more proactive, preventive focus, helping people stay healthy and well, but empowered and fueled and enabled by digital tools and technologies that zero right in on those few resources we have in the workforce to focus on the highest risk populations and give them the tools to help themselves. Instead of waiting for the diagnosis and then it's much more expensive. Yeah, absolutely. And it makes sense when we put it like that. But as you say, like in Canada, there's the 2% of the I think global health, the health spend that you mentioned in preventative health. And I guess the reason why a lot of the times there's not a heap of investment in the preventative health side is it's difficult to then quantify how successful something was if it didn't happen. Exactly. How do you measure something that never happened? That's true. Very true. So I guess, but as to your point, being data driven, the more data we can collect to be able to then demonstrate the potential, and then by
having that clear return on investment, that can hopefully then drive some of these benefits in the preventative space.
I couldn't agree more. The other thing I think we forget is the consumer general public are out there. They use all kinds of different health apps and tools, smartwatches, sensors, you name it.
People look for stuff.
They are looking for stuff. Have you ever wondered why none of that stuff connects to a formal health system?
Yeah.
So you have a single source of truth with providers that understand, don't waste your time and money over here, but this tool and opportunity would be amazing.
Yeah.
And the population we probably should start with or spend more time focusing on is the chronic conditions you've mentioned. Right now, with a disease-focused system, we tend to have pathways for each diagnosis. Diabetes pathways, COPD, the usual. Where are the pathways that are multi-comorbidity, multiple diagnosis? We don't really have those. So what does that patient with 2 or 3 diagnoses end up doing? Dr. Google, maybe?
Sure.
A few apps and tools. So I think the consumer public's already there. They are managing their health and wellness, whether it's the best way, it's the way they have access, the way they think it's the best, or they have access to.
Yeah.
Maybe we need to look a little more closely at that preventive strategy in mobilizing the strengths we already have.
Yeah.
And by the way, it's different for different generations. What the millennials need on health and wellness is probably different than the baby boomers, different again from Gen Z, Gen X, because they all come at this with their very unique value proposition.
Yeah, it's complex and very, very important point that you made around the multimorbidities and that no one has a single chronic disease usually, and it also needs to be, there's a lot of underrepresentation in terms of gender, and the list goes on. So, but as you were saying that too, I also made me think about, I guess, where people get their information. They get their information from places they trust. And I guess one challenge, I'm not sure what the right answer is if we're looking at doing a system-wide kind of education campaign or helping people understand the right way to do things. Right now, I feel like if the government or if an authoritative body were to tell people what the right thing to do is, it probably won't land.
It won't go well. Yes, it won't go well.
No matter where you are in the world right now.
Right.
It's and that's a challenge. So people go to places that they trust.
And part of what you're getting at, maybe going off a bit track, but part of what you're getting at is where health systems have been for decades is what I would call, forgive me, that patriarchal. Yeah. Do this, eat right, exercise this often, and you will be healthy. It's that telling people what to do. Maybe the opportunity, particularly with all the tools and technologies available, is help people make informed decisions.
Yes.
That's going to work best for their health goals rather than the goals a health system or a government or anyone else sets for them.
Yeah.
We are all, what it means to be human for me is the autonomy to make a decision. Maybe the education piece is, how do you know what data is accurate?
Yeah.
How do you know what the best options are for you, where you want to achieve outcomes rather than where a system or provider tells you where to achieve? And that might be where we haven't spent as much time.
I think you're right. Well, I know you're right, because I think about there are large populations of individuals who are super interested in understanding more about their own body through diagnostic tests.
Yes.
And some of the tests that have been influenced to them may not be the most appropriate, may be good intention, may not be good intention, but it could be good intention, but could be an expensive, inappropriate use of the healthcare system. However, if we could get to a point where we're helping people get access to their information accurately, and so then they can then choose how they do that. I think we sometimes, as systems, we place too much emphasis on that very last bit, which is, now this is what you should go and do. If we get all the way up to the point, then that could be...
That's the pathway.
Yeah.
If we were much more systematic and seamless to flow data and insights, it's not just the data. You have to make sense of what does that data mean for me? So it's about flowing data and analytics that a person could use to understand, is that helping me meet my goal, or is it helping me make it harder to meet my goal? That's a lot of that. Some of that's data literacy, but it's also embedding the tools to help you know, gee, you have made huge progress in this. Keep going.
Yeah.
Or you haven't made any progress. Your blood sugars have plateaued, and helping them understand what options are next. I think it's meeting people where they are.
Yeah.
And that's why digital health becomes now so important. We call it the person-enabled health system.
Yeah.
Start where that person is. What are the choices they should have in front of them to make, and what are the tools and decisions informed by data that we can help with them? That's what it builds trust. And it builds confidence that I do have a source, a provider team, a data that helps me understand, yes, this is right for me.
Yeah.
Rather than the pathway tells me I should do A and then B and then C.
Yeah. More focus on that scoreboard. I think everyone knows how to read a scoreboard in sports and everything, but if we don't know what the score is, because if you see a number that's here and it needs to be here, then you kind of like work out the gap there. So I could chat for ages with you, Anne, but you've got a show to go to,
and you've got other people to chat with, so I understand.
But anyway, but lastly, to close it out, it's you've probably done a couple of HIMSS. Like any other final key things you hope that people take away from this particular one in Vegas today? Like things you would hope that attendees take away from HIMSS.
I would say, given the very high uncertainty we see in the world today on many fronts, what I think people take away from HIMSS is this is a community to connect to learn from, to manage that uncertainty, and to progress towards making things better. Safety in numbers might be another way to say that.
Yeah.
But when you're facing high uncertainty, and as a clinician, when I used to work with patients and families, knowing there were people going through similar uncertainties with me, and having people, communities, teams to learn from, made it better, improved coping, offered what's possible, what's achievable. And that's what we need to focus on. What's possible, what's achievable, and how can I learn from others to achieve what goals I'm pursuing. I think that would be the takeaway for me this year.